Assalamu alaikum wa rahmatullahi wa barakatuh, students. The vocabulary for Unit 12. Vocabulary Unit 12. Let's have a look. So here it is. Let's zoom in a little bit. Probably have to move over here. Oops. Move over here a little bit. Here we go. Vocabulary for Unit 12. We're going to start with the nouns, of course, the names of things. So we're going to start with body parts, parts of the body. And in the beginning of Unit 12, there is a picture, all right? There's a picture in Unit 12 for all of these names. There's a picture. Okay, I went and got a book for Unit 12. So if you look here, right, there is a picture and a list of all the body parts. All right, so you can use the audio and look at this picture at the beginning of Unit 12. So let's look at them together. Feel free to use the picture. So we have ankle, ankle, arm, back, brain, chest, chin, chin, this thing here, this right here, and the ear, ear, elbow, elbow, eye, eyebrow. This is your eye, eyebrow. Finger, fingers. Foot, 1 foot, 2 feet. So this is irregular. Feet. Hat. Sorry, hair. Oh, it's too small. Hair. Hand. Head. Heart. Hip. Knee. Leg. Mouth. Mouth. Neck, nose, shoulder, skin, stomach. Then we come back up here. Throat, we have TH, TH, throat. Thumb, this, thumb, thumb. Toe, toe, toes. So these are fingers. These are fingers. On your feet, they're called toes. Hand, fingers. Foot, toes. Tooth, tooth, tooth. Wrist, wrist. So here, the W is silent, silent. Wrist, wrist. Health problems, health problems. Backache, backache. So ache, ache means pain. You have some kind of pain, right? Backache or back pain. But maybe ache is a little bit less, right? Pain is a little bit higher, right? But there's a little bit of pain in your backache, back pain. Cold, cold. Cough, 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 cough. This comes out, cough, like F, cough. Dry eyes, dry eyes. So dry eyes means no water. No water. Dry means no water. No water. So if I said the badia is dry, badia, the desert is dry, there's no water. Earache, earache. So we had backache, now we have earache. Oh, I have an earache. Fever, fever, when you're hot, right? Fever, when you're sick. The flu, the flu, the flu, from influenza, the flu. Headache. So we had backache, now we had earache, then we have headache. Oh, I have a headache. Headache. Sore throat. So here, this is your throat, right? And here it's sore. You can't swallow. Ah, I have a sore throat. Sore throat. Stomach ache. Now we have stomach ache. Oh, I got stomach ache. Too much chocolate. And toothache. Toothache. Medications and remedies. Medications and remedies. Antacid. Antacid. So, ant means against. Antacid, yani it's against acid. Antacid. Aspirin. Aspirin. Chamomile tea. Chamomile tea. Chicken soup. Chicken soup. Cold medicine. Cold medicine. So when you're sick, we say you have a cold. Influenza, you have a cold. So cold medicine is medicine for influenza or medicine for somebody who's sick, right? Cold medicine. Cough syrup. Cough syrup. So if you're coughing, they have this little thing that you can drink, right? Cough syrup. Eardrops. Eardrops. Eardrops, something you put inside your ear, right? These drops. So this is a drop. This is a drop. Eardrops, eye drops, right? Well, sorry, this says eye drops. So I need some eye drops. Eye drops, eye drops. Ice pack. Ice pack. And nasal spray. Nasal is your nose. Nasal. Nasal spray in your nose. Nasal spray. And we have other nouns for medications and remedies. So we have bacteria, bacteria, cells, dentist, dentist. So if you have a toothache, you have to go to the dentist. Electricity, electricity, electricity. Don't forget about the T. Electricity. Hour. Hour. So this H is silence. Hour. Part. Part. Patient. Patient. So if you're sick and you're in the hospital, then you're a patient. Or if you go to the dentist and he works on your mouth, you're the doctor's patient. The doctor's patient. You're his patient. Rest. Rest. Relax. Sleep. Take a nap. Rest. Signals. Signals. And soda. 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 You may have the same thing here. Positive feelings. Positive feelings. So I'm feeling better. I'm feeling fantastic. I'm feeling fine. I'm feeling great. Great. Terrific. All right? So better, fantastic, fine, great, terrific, all of these are positive. Negative feelings, awful. I'm feeling awful. So this is very bad. Very bad. Exhausted, very tired. Very tired. Horrible, also very bad. Miserable, also very bad. Sick is ill, yani sick. Sore, yani you went to the gym or you went running and now, oh, my muscles are sore, right? Sore. Terrible, very bad, terrible. And tired, very sleepy, very tired. The next one on the top, other, noisy and wrong. Noisy and wrong. So we have wrong, the opposite is right. Wrong, right. Wrong, right. And then we have noisy. Noisy is a lot of noise. My children are very noisy. Ah, noisy, ah. Verbs. Beat. Feel, have, hurt. What does it say? Lose, relax, stay up, take a book, take a look. Take a look. I need to make this bigger. And much. Adverbs. Much, so, and well. Much, so, and well. Let's go down here to the bottom. The expressions. Talking about health problems. So again, the first thing we have are these questions. How are you? How do you feel today? How do you feel today? So we have I feel better. Not so good. Not so well. What's the matter? Yani what's wrong? What's the matter? What's wrong? Yeah, and then we have also what's wrong. So what's the matter and what's wrong, they're kind of the same, right? What's the matter and what's wrong? I feel sick, I feel terrible, I don't feel well. Expressing sympathy. That's too bad. I'm sorry to hear that. That's good. And I'm glad to hear that. So when you're listening, you can answer the person, right? That's too bad. I'm glad to hear that, right? Just trying to fix something, but it didn't work. All right. Refusing something politely. Do you want coffee? No, but thanks anyway. So listen, this is Very nice. Yani, this is a nice way to say no. Yani, do you want a cup of coffee? No. Yani, not nice. No, but thanks anyway. No, but thanks anyway. Asking for permission. Is that okay? Is that okay? Giving a suggestion. I have an idea. I have an idea. Take. Don't take. Take and yes, or take and don't take. Take and don't take. Eat, don't eat. Eat, don't eat. And the last one, asking for more information. Anything else? Anything else? Is there something extra? Is there anything else? Is there anything more? All right, my students, I would like you to please mark the words that you don't know, all right? So that you can practice them and study them and use them. Practice them and study them and use them. So please remember that you are on a journey and hopefully you will do well. Assalamu alaikum wa rahmatullahi wa barakatuh.